So first we're gonna turn the machine on, wait for it to warm up for a little bit, and then now that it's on, we're gonna go over here, click biphasic because we're doing NMES, and then for the duration, I'm gonna do 10:30. The ramp time, I'm gonna upgrade it to 1, and then rate is good. Width, I can have it at 200 or higher. I'm gonna leave it at 200. You at least need 200 microseconds for muscle contraction, and so they are ready. So the machine is ready to go.
Hi, my name is Kyler Edwards, physical therapy student from Rocky Mountain University. Today we have a patient, Isaiah, who had an ACL reconstruction surgery 2 weeks ago. And so what we're gonna do is we are gonna do E-stem for Isaiah. The reason is he has an indication for E-stem. He is unable or having trouble firing his quadricep muscles since the surgery. And an indication for specifically NMES is that it helps with reactivation and contraction of the muscles, specifically in this case the quadricep muscle. So we're going to focus and go through some E-stem through NMES. Contraindications are pacemakers, active cancer, impaired cognition, and lack of sensation in the area. Isaiah does not suffer from any of these, so he does not have any contraindications that say we should not use E-stem. So we are going to use E-stem to help him fire that quadricep muscle better and hopefully help him heal and start being better during his therapy session. Hi Isaiah, how are you doing today?
Good, how are you?
I'm good. So what I would like to do today is we're going to try some E-stem. Have you had E-stem before?
No.
Okay. So just quickly about it is what we're going to do is I'm going to, as you can see, I'm going to put these electrodes on you. And what that's going to do is that's going to cause your quadricep or your thigh muscle to activate or contract. Because since the surgery, you've been having trouble contracting your quad. And so what this is going to do is it's going to help you contract your quad. And that way we can start having those muscles get used to contracting again and have those nerves firing to the muscle. Okay? So would you be open to trying E-stem today?
Yeah.
All right, perfect. So we already have the electrodes on in place, and so specifically the one proximal is going to be on his motor plate. That's where we have our most neuromuscular junctions, so that way we can get a stronger contraction. Yep. So what I'm gonna do is I'm gonna turn this machine on, and you start letting me know when you feel sensation in your leg, okay? So I'm just gonna turn it up slowly for you. And then let me know when you start feeling that sensation.
Starting to feel it.
Okay, you're starting to feel it? Perfect. So now we're gonna go until we see a contraction. So there we can see your muscles starting to fire. Alright, looks like it's really contracting. And then you let me know when it gets too much, okay?
Okay. Put it right there.
Okay. So the goal is to have this muscle contract at least 50% compared to your other leg. So do you feel that's about 50% contraction? All right, perfect. So what I'm going to do is I'm going to press start. And what that's going to do is it's going to cause your muscles to contract for about 10 seconds. And then it's going to let them relax for 10 seconds. And it's going to repeat that. So when it causes your muscle to contract, I want you to also think about contracting your muscle as well along with it, okay? And so we're going to do this for a number of reps. And really just focusing on firing and activating that quad every time it contracts. Perfect. All right, so that we've gone for the full 10 minutes. And so now I'm going to turn it off and take these on you. So what'd you think? How'd you feel after E-stem?
I feel pretty good.
Okay, you feel like you can contract that muscle a bit easier?
Yeah, definitely.
All right, perfect. Well, sounds like it worked.